Welcome to one more edition of Politics and Right. I'm Egberto Willis, your host. Today, I'm honored to bring to our program again a very special person, Chuck, and I'm going to say it correctly, Chuck Pennacchio, good friend of mine, the guy I call a brother from another mother. How you doing, my friend?
Egberto, really doing well. Thank you so much for having me.
Well, great. Look, Chuck, you've been working so hard in the field of healthcare, bringing a single-payer healthcare for all. In your case, you understand that it has to be done currently, hopefully later differently, but currently state by state. Why don't you tell us a little bit about the project of OnePayerStates?
Sure, absolutely. So I've been doing this political work since I was 13. I'm now 64, coming up on Medicare this fall. And I got involved in many, many different issue areas, ran for U.S. Senate, and then landed on healthcare. After that Senate race, we put together a statewide organization in Pennsylvania. And then realizing politically the way to get this done was to study the economics of healthcare. So that really is what is important to understand about how we're going to get this done politically. We have to make the economic argument, the business argument, and let people know that they're being taxed through ways they don't even realize and paying for healthcare.
Exactly.
So how is it going to work? This is similar to how Canada was able to get to national healthcare through one province, Saskatchewan.
Was this Saskatchewan?
Saskatchewan,
okay.
right, in the 1960s. And right now our leading states are California, Oregon, Washington, Minnesota, New York, Massachusetts, and Maine.
Right.
And they all have slightly different approaches. Oregon is leading the way. They've just instituted their governing board. And once we're able to model that effectively, it'll prove the point.
Exactly.
And then, go ahead.
No. I'm saying it, once you show that it works, they usually call the states the laboratory, right?
Absolutely.
What is it? The laboratory of democracy, or the laboratory? Many other kinds of laboratory. We use it as a states as a laboratory. We can then expand it out to the entire country,
Absolutely.
And that is what we're doing.
Absolutely, and really, almost all significant national social justice, economic justice, political justice, racial justice issues started at the state level. Voting rights, child labor laws, all that stuff started at the state level. And you know this history, your audience, most of them know it, but the progressive era started in Milwaukee.
Yes.
And then it went statewide to Wisconsin, and then it went national with Teddy Roosevelt. But those ideas that Teddy Roosevelt and then later Franklin Roosevelt implemented were all modeled at the state and at the local and state level first.
Right.
Franklin Roosevelt's programs were modeled in Albany, New York, and they went national when he becomes president. So this is the way that the history and our Constitution are designed to get us reform, is through state modeling, and that's in fact the way most of this stuff works.
Let me tell you, Chuck, because I believe in the promotion of anything that's going to move us forward in healthcare. And one of the things I think that we have to do as proponents for a universal healthcare system is that we have to there are several organizations working on this.
Absolutely.
We have to give all these organizations the freedom to try to do it as they are able to do so. That is what we have to do. We have to be able to do that. I have been pushing one state in many different platforms, and I can say that I have gotten sometimes within the progressive movement some pushback because you and your organization have taken a pragmatic approach to say, let's do it where we can right now to simply help people.
Right.
How can you best express to those who are tunnel visioned in a lot of ways and saying we have to go ahead and do it on an entire country basis or nothing?
Well, first off, I would say that people who represent themselves as progressives are not understanding the progressive era movement, which in fact was a municipal and state-based movement.
Exactly.
That was the progressive era.
Right.
And as well, progressivism, the idea of progressivism is, as you said, to work together with people.
Exactly.
This whole circular firing squad and shooting people because they're not doing it exactly the way that you want. So there's this sort of ideological purity that's holding people back as well. And it's ignoring our history, which I just touched on with the Progressive Era, the New Deal era, the Great Society. All of those programs were modeled at the state and local level. So how do you ignore our history? How do you ignore our Constitution? And how do you ignore the money that's arrayed in Washington, D.C. against any significant national change, especially in healthcare?
Right.
It's ignoring the medical industrial complex, right? The big four, I call them the four horsemen from hell. The four horsemen from hell: pharmaceuticals, big hospitals, big insurance, and the big manufacturers of medical equipment. They buy politicians.
Right.
So right now, I love Pramila Jayapal. She carried our bill before then handing it off to Ro Khanna.
Right.
Jayapal is carrying the National Medicare for All bill. That bill has 112 sponsors. That's just over half of the Democratic caucus.
Right.
No Republicans, and a lot of Democrats are not going to sign on because they're wedded to money that they're taking from the medical industry.
Right.
So what they see, the way forward and the way that we're targeting our message, is that we can get those centrist Democrats by telling them, in fact, that our legislation, this is the Ro Khanna legislation,
Right.
that Ed Markey will be introducing shortly in the Senate.
Right.
It's called the State-Based Universal Healthcare Act.
Right.
State-Based Universal Healthcare Act, HR 6270.
Right.
It's got a number in the House, HR 6270. When Markey introduces it, it'll have a Senate bill. But that legislation is designed actually to expand on the Affordable Care Act.
Right.
So for a lot of centrist Democrats, they're okay with expanding on the Affordable Care Act.
And what it's going to do is, in effect, it's going to create universal health care in states who want it.
Absolutely.
And then I don't want to use the word the jealousy, but when other states see, well, my God, how is it that this state can provide all of its citizens care? We want it too. And as more adapted, you get it. But the thing about it is we have to start somewhere. We can't just, and you know, that is why I push so hard when we get the pushback. Well, you know, it's either all or nothing, because if you get some, you won't get the rest. Well, you know what? If Oregon and California, and California sort of failed us because they backed off, but if we get all these other states to do it, and there are Texas and Mississippi and Louisiana decide that they want to continue murdering their people, let them, and then we can keep. And when I say let them, I don't say let them in a facetious negative manner. I mean, let the politicians try, because if the people would eventually have their heads.
Right. Well, I think that this is also a way of shaming them, like proving that we can cover all citizens within these model states.
Exactly. If we believe in the concept,
absolutely.
If we believe in the concept of universal health care, and we get it to work in Oregon, if we get it to work in Washington, if we get it to work in Maine, and what's the fourth one?
New York.
And New York. If we get it working there, we would have gotten it into a partially rural state, an urban state, a multi-state in Oregon. I mean, we would have proved that it could work everywhere.
Right. And not only is it designed to get all the healthcare people need from cradle to grave, but it also provides now the choice. You get to choose your doctor. You get to choose your hospital. Whereas right now, insurance companies
choose it for you.
Yep.
And that's the magic, right? The insurance companies are nothing more than a fraud. We all know that. And for those that are listening, I repeat, and I don't say this biting my tongue, every health insurance company is nothing but a fraudulent business. As Bernie would call it, he would call it a business based on fraud. Sir.
It's legal, unfortunately. Unfortunately.
Yes.
And they're doing their job. I mean, you stop and think about it.
Yes.
The CEOs of these companies, their job is to make their stockholders as much money as they possibly can.
And that's why it doesn't belong in healthcare.
Absolutely.
And that's why it doesn't belong in healthcare. So, Chuck, let me ask you this, because you are working extraordinarily hard, day and night, pushing this stuff. What is it that your organization needs to get to move to that other step?
Contact your U.S. representatives. Go onto our website and see where we are in terms of. We have 29 co-sponsors now in the House on HR 6270. That's the State-Based Universal Health Care. And then we're about to be introducing the Senate bill. Ed Markey will be introducing that. So contact both your U.S. senators. I don't care, Democrat, Republican, contact them and let them know that you want them to sign on as a co-sponsor, because this is a legislation that will enable the states, as you said, to model to become the innovators, to become the incubators, to become the place where we can actually model solutions. And that's the beautiful thing. So contact your legislators in the U.S. House and in the U.S. Senate. Get these bills passed, and then encourage your state, if they're not already moving on it, get a legislator to introduce a Medicare for all, single payer bill, universal health care bill at the state level.
Now, what should I have asked you that I didn't, or what would you like to say that we hadn't covered?
How are we going to win? How are you going to build enough power, political power? Mm-hmm. And that's to recognize that healthcare is at the intersection of all other social justice issues. Mm-hmm. What we call healthcare justice and mm-hmm. health justice. So that's food, that's housing, that's policing, that's climate. You name it, it's war. It's all these issues that we've got to wrap our minds together and connect with one another and see each other as co-equals in this effort. So we all need to pull together. We call it transformational justice for all, mm-hmm. universal transformational justice. And the Intergenerational Justice Summit work that we do brings younger people into the fight, diverse populations, Black, brown, LGBTQ communities, immigrants, into the fight, seeing each other as co-equals. We need to see each other as co-equals, that if you don't have a roof over your head, nothing else is going to matter. Mm-hmm. We need to help you get a roof over your head. If you don't have food on your table for you and your family, we have to make sure that food justice is part of the fight as well. So everybody pulling together, everybody wins together, everybody gets all their issues passed.
Chuck Pennacchio, your work is invaluable. Thank you for what you're doing. Please keep up the power, and whatever it is that we can do to make sure that your message is out there, remember we are here to serve.
Absolutely.
Thank you so kindly.
Pleasure. Thanks so much, Egberto.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead, number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.